I'm Brian Hartl. I'm an epidemiologist at the Kent County Health Department. Today at the City Commission meeting, we simply wanted to have a chance to provide to the City Commissioners just an idea of what's been going on in terms of preparedness for Ebola at the county level, as well as with our community partners, and to develop a coordinated response to Ebola. So at the Health Department, the Kent County Health Department, we've implemented our incident command system, which is a way to respond to events or to prepare for events. We've done a number of things, in that incident command system, and we've looked at a number of areas that we need to prepare for and have instituted, if a case comes to Kent County. One of those is dealing with isolation and quarantine issues. So we have public health powers that allow us to order individuals to be isolated or be quarantined if they're a public health threat to the community. So we're working with corporate counsel, our lawyers, to make sure we have language in place, letters in place that we can, pull those out if we need them, if someone's not cooperative with what we're recommending them to do. Another big area is communication. We want to make sure that the public and schools and everyone, all sectors of the community are aware of what the risk is. We hear a lot on the news media about Ebola, and it's kind of frightening when we hear that, but we want to get the facts out there, make sure that people understand how it's transmitted, what to do in the event that there's a case in the county. So we want to make sure that all that communication material is out there and easily readable by our community. We have situations like hazmat and cleaning up after a case. We've seen the things on the news where cases in Dallas and cases in New York. We've got people with hazmat suits on, in the apartments of these individuals, cleaning up to make sure that there's no, virus, in there. So we're working with our environmental health department to identify, local agencies who can take care of that if we need, in the event that we need that. Animals, we have our animal control officers, we have an animal shelter, so if there's a situation where a case is here, they have pets in the household, do we quarantine those, how do we do that, where do we do that? Those are questions that we're all answering, with our preparedness. And finally, the biggest thing I think is contact tracing. That means any time there's a case, you want to make sure that you're keeping track of those individuals who were in close contact with the case. So that's what we do in epidemiology and communicable diseases. So we have guidelines in place from the CDC that allow us to categorize people's risk. Were they a direct care worker? Do they provide direct contact or direct patient care to an individual? Or were they just someone in the same room with that individual? And there's different levels of risk, different ways that we trace them, either face-to-face tracing and taking their temperatures, or just simply calling them on the phone to identify whether or not they have symptoms of Ebola, and then we can coordinate care for that patient if they do show symptoms. So it's really a way to prevent further cases, further exposures, if there is one case in Kent County. And then the last thing I talked about is travelers. So the CDC has a traveler monitor system now in place where all individuals returning to the United States from the 3 affected countries in West Africa are all being funneled to 5 airports that are trained to provide screening of these individuals, provide them with information about symptoms of Ebola, what to do in the event that you have symptoms. And then those individuals are sent through state health departments to local health departments, and then the local health departments do active monitoring of these individuals. So we have one individual in Kent County who's recently returned from those regions, and so now we're calling them every day, twice a day, to get information on their symptoms, asking them, how are you feeling? Are you still doing well? And then having them take their temperature and report their temperature to us twice a day. So we can monitor that and make sure that if they do show any signs and symptoms of Ebola, then we can then in turn contact EMS, contact our hospitals, and let them know that we have a case. So really to limit exposures that might occur, if someone does indeed, become sick with Ebola. But at this point, this person has no high-risk exposures in the countries, so it's a very low-risk individual who is in Kent County. Yeah, the health department has on our homepage, our website, we have an Ebola website. Just go to accesskent.com. And go to the health department, and we have Ebola information on there. But the best place is the CDC. So if you go to cdc.gov, they have an Ebola page right there with all information for anyone from healthcare workers to first responders to health departments to the general public. That's really your go-to source for all information on Ebola is cdc.gov.